Hi, welcome to the first edition of Health Beat. I'm your host, Dr. Chris Bennett of Orion Family Spinal Center, and I'm joined by my co-host, Dr. Dustin McGyver of McGyver Chiropractic Center. This show is based on different health topics and basically to help the community understand how to become healthier in today's society. And so, Dr. McGyver, if you could tell us a little bit about yourself.
Well, first of all, thanks for having me here. I'm very excited to be doing the show. I am an upper cervical chiropractor, and I practice here in Michigan in Ionia. It's right in between Grand Rapids and Lansing, for those of you that don't know. I graduated just last year in March 2013 from Atlanta. The school is called Life University in Atlanta, Georgia, and then I moved back. I'm born and raised in Michigan. Moved back to Michigan to open up my own practice with my beautiful wife. We are about 8.5 months expecting. So just waiting to
Congratulations.
Thank you. Just waiting to become a father here pretty quick. But yep, I practice here in Ionia, serving lots of people, and just really enjoy what I do. And I'm hoping just through this show to educate more people about health, what it is to be healthy, kind of a little bit of a paradigm shift on what you may have thought about certain topics and what health is, and other avenues that you can look at it. So just helping to help some people out, educate people on what health is, and sit next to you and do this.
Sweet. Well, we're glad to have you.
Thank you.
I actually attended Life University also. I went there and I graduated in 2010. Excuse me.
School looked a little different back then.
It did look a little different back then. And so I actually got interested in upper cervical work also about halfway through school when I became very sick and ill. And I didn't, because no one ever really taught me the principles behind health and how you become healthy. And so I had a good friend of mine that was an upper cervical doctor, and he explained how you become healthy and where health comes from. And so I became very passionate about that and learned upper cervical work and really dove in with both feet and spent many years getting better and better and learning more and more about this area here and how it affects your health. Mm-hmm. And so I actually decided to do this show for the same reason, to educate the community, because I want to teach people what I didn't know.
Right.
And maybe I can help one or two people, maybe even more than that, avoid sickness and disease like I unfortunately had to encounter.
Yeah. Obviously, we've been talking a little bit about upper cervical, and we just said, I'm an upper cervical chiropractor. So a lot of you people probably don't even understand what upper cervical is. So yes, we are chiropractors, but we focus upper cervical on the top two bones of our neck. And the reason we're focused on that area is because a very special part of your nervous system sits right down here. It's called the brainstem. The brainstem essentially connects your brain and your spinal cord. The brainstem, however, controls all functions of the body. Any system that you've ever heard of, digestive system, respiratory system, lymphatic, reproductive, endocrine, that's all being controlled by the brainstem. So that top bone is actually a free-floating bone. There's nothing that connects that top bone, the top bone of your neck, with your skull and the second bone. It's just being held together by tiny muscles and tiny ligaments. So that's what allows you to turn your head from side to side, which is such a great deal of range of motion, but we give up a lot of stability in that area to have such great mobility. So we in this profession, we joke around that it's a really sloppy joint because of that. Okay. So because that top bone is just held together by muscles and ligaments, it can actually get off of its track and get stuck there. And when it gets stuck there, it can put pressure on that brainstem. So no information can go from your brain down out to your body without having to run through that brainstem. It's got to run through there. So you can think of the brainstem as almost the circuit breaker of your nervous system. It's just a crazy mess of information before it knows exactly what nerve it's going to be and where it's going to go. So if your top bone goes out of place and puts pressure on that brainstem, it can cause interference from your brain and your body's ability to talk to each other, to send signals. So let's say my top bone goes out of place and it interferes with the nerve that eventually is going to my small intestines. Now my small intestines can't get the right signal to say, hey, something's going on. The brain can't give the right signals to the small intestines to say, okay, this is how we're going to fix it. Now the small intestines don't function the way that they should. They start operating differently, which means things start to break down. And what do? We label that as a disease. So now I could have irritable bowel syndrome, Your top bone could go out of place, putting pressure on the brainstem that goes maybe up into the face, the nerves that go up into the face, and now you have allergies, sinus infections, ear infections. You can have a lot of different symptoms depending on how your top bone goes out, therefore what area is it going to interfere with. So when we're talking about upper cervical doesn't treat anything. All we're doing is making sure this top bone is in its proper position, putting no interference on the brainstem so that your brain and your body are in constant communication with each other. If they're in constant communication with each other, you're going to have 100% function. We joke around to say the best doctor in the world is your own body. Your body has made everything inside of it. Therefore, it knows how to maintain it, regulate it, and heal it. But how does it maintain, regulate, and heal? By talking to itself through its central nervous system. So if we're not maintaining, regulating, or healing, that tells me that there's some interference going on in this pathway. We need to remove that interference, reestablish those connections, so that the best doctor in the world, your own body, can essentially get back to work. So that's what upper cervical is in a nutshell, and that's what we're going to base a lot of these conversations about health, and we're going to tie them back into upper cervical to try and help people think a little bit differently on what health is, where does health truly come from? Because health doesn't come from the outside in. First, we need to start with the inside out.
Exactly.
All the exercise and diet in the world are fantastic, but that's not going to truly fix anything if we're not functioning at 100% from the inside.
So we're going to take a short break, and when we get back, we're going to discuss heart disease. You're watching Health Beat. Stay tuned.
Hey, this is Mickey York from Fox Sports Detroit. When I want to get the inside scoop on local sports, I watch Between Terminos or Fox Sports Detroit.
Hi, welcome back to Health Beat. I'm Dr. Bennett, and I'm joined by my co-host, Dr. MacGyver. And today we're going to discuss heart disease. First, we need to talk a little bit more about the heart and what it is and how it works.
Yes.
So the heart is basically a pump in the body that's made up of 4 chambers. And 2 of those chambers on the right side are designed to push blood to the lungs so that the lungs can provide oxygen and nutrients to that blood. That blood is then shunted back to the heart, and the left side of the heart actually takes that blood then and pumps it through the entire body so that we can have oxygen and nutrients going to all the muscles, organs, cells, and tissues of the body.
Right.
So what controls the heart? The heart is really controlled by your nervous system. And ultimately, all those nerves that go from your heart into your spinal cord travel up your spinal cord to your brain stem. And so that's another reason why upper cervical work is so important, because those top 2 bones in the neck actually protect that brain stem and can sometimes actually be the cause of the problem though. So with that, let's discuss a little bit more about heart disease, because we hear that term thrown around a lot. What is heart disease?
Yep, most people understand what heart disease is. So heart disease is the #1 killer in America, men and women. A lot of times we focus on the cancers and we have charity events for cancers, but when you really look at the research, heart disease is the #1 killer amongst men and women in the United States, in the world, everywhere. It's the #1. So heart disease is pretty important. Unfortunately, when do most people realize that something's wrong with their heart? When they get a symptom.
Right.
What is the number? Usually, a lot of the times, what's the very first symptom of heart disease?
Usually a heart attack.
Usually a heart attack. And a lot of people, for that point, it can be too late. So what caused the heart attack? What's caused the heart disease? Well, the heart needs to lose about 40% function, needs to get to about 60% function before that heart is going to give you some indication that something's not right. So by the time you get some kind of a symptom to say, hey, something's wrong, I need to go to my medical doctor and get this checked out, your heart is already functioning down to 60%. And like we just said, for a lot of people, that first symptom, unfortunately, that symptom for you might be a heart attack. But why is the heart functioning at only 60%? So when we talked about all those nerves, what controls everything in your body? Your nervous system. So if I was to cut the nerve that went out to your heart, is your heart going to be functioning at 100%?
No.
No, silly question. It's not going to be functioning at all. But if this top bone goes out of place and it's interfering with the nerves that go to the heart, causing interference, is that heart going to be functioning at 100%?
No.
No. Let's say it's only functioning now at 60%. How long is it going to take for that heart to start showing you signs and symptoms that something's wrong? Days, weeks, could take years. There are people walking around with their top bone slightly out of place, putting a little pressure on that brainstem, causing a little bit of interference going to that heart. They're walking around with it for years. It's basically a ticking time bomb because the heart is no longer functioning at 100%, and it's only a matter of time before you get that first symptom. And like we said, a lot of the times that first symptom, unfortunately, is a heart attack.
Right, and that's just too late. So we need to look at, okay, so what are some of the conventional medical treatments for like something like high blood pressure, as an example?
So let's say you didn't have that heart attack, but you went in, something's not right, and the doctor says, okay, well, your heart's not functioning the way that they should, your blood pressure's off. So what are they going to do? They're going to give you blood pressure medicine. What does the blood pressure medicine do? It causes you to spit out those beautiful numbers on a test that says, oh, I'm 120/80,
Yep.
Everybody's feeling good. You get to go home with basically a clean report card of saying, look, my blood pressure's right where it needs to be. Take away that blood pressure medicine, though. Now where's your blood pressure at?
It goes right back up.
Goes right back up to what it was. So is the blood pressure treating the numbers and getting the numbers to say what they should be, or is the blood pressure medicine actually treating the cause of why the heart wasn't functioning the way that it should?
Yeah.
It's basically just causing you to have the correct numbers.
Right.
Then we got all the side effects and the symptoms of being on the blood pressure medicine, which results in having to take more medication, which also have side effects, and you sort of go down this downward spiral. What do most people taking blood pressure medicine eventually die of? Some kind of a heart-related problem.
Yeah.
The blood pressure medicine isn't treating the heart.
Yes.
We need to find out, why are the numbers off? I could almost care less what the numbers are. I want to know why those numbers aren't where they should be. And the numbers aren't where they should be is because the heart's not functioning the way that it should be.
Right.
Why is the heart not functioning the way that it should be? Because the nervous system, there's some kind of an interference going on, so it's not able to do its job correctly.
It's not getting the proper message. And that's the thing, that's the unfortunate trade-off is that, you start taking that medication, and yeah, like you said, it gives you great numbers and it makes your doctor happy, makes them smile because now your blood pressure's perfect. But the problem is that, like you said, it's just covering up the symptom.
Mm-hmm.
So whatever it was that was causing that heart to grow sick to begin with is still going on.
Yep, the entire
it's
time.
It's still there. And so that's why most of the time it leads to that point where most people, even though they're on that medication, they still wind up dying from something that's a heart disease-related illness.
Yep, the heart's only functioning at 60% the entire time they're taking blood pressure medicine,
Exactly.
and the entire time they're still growing heart disease.
Exactly.
But it's not the medical doctor's fault. The medical doctor did exactly what he said he was going to do. We're not knocking medical doctors in any means. They're fantastic. It's just the system that they operate and how the medical community views health. That's just how they view health. It's just a different way of looking at it, and it's a proven system that just doesn't work the way that it should.
Right, which is why I heard a statistic recently that the U.S. takes about 80% of the medications in the world, but yet we make up 5% of the world's population.
Right.
Yet our number one killer is still heart disease, and the numbers continue to rise.
Yep.
So we're missing the boat somewhere.
Exactly. The
in our
World Health
system.
Organization ranked all of its members. We ranked 37th in overall health. Yet, like you just said, we consume more drugs than anybody. Right. So if the drugs and the medication were the key to health, we should, in theory, be ranked number one.
Exactly.
But we're not. We're ranked 37th. The medication, the surgeries, all of that, that's sickness care. That's an emergency case. We shouldn't be using those same things that we use for emergencies to get us back to health.
Exactly.
In order to get health, we need to have 100% function. And that starts with making sure your body is functioning at 100%. That nervous system is 100% connected.
So I know I've had several cases where I've had a patient come in and they've gotten some great results with different conditions.
Mm-hmm.
And I know that you had we had talked previously, and you actually had a case recently in your office that had a high blood pressure and heart disease and got some interesting outcomes.
Yeah.
So I was wondering if you could discuss that.
Yeah, absolutely. This is an interesting case in that, so you'll see on these x-rays, the first one here, you can see what this gentleman's curve looked like, the curve of the cervical spine. The cervical bones are the vertebra of your neck. And you can see this person basically lost their curve. They almost had like a little bit of an S shape going on. Now this gentleman, when he came in on the first day and I said, how may we help you? What can we do for you? He basically just said, I'm just curious to see what you do. You're new in town. You do this different version of chiropractic that I've never heard of. I just want to see what you do. Had no complaints, nothing wrong, no pains, no nothing. Just wanted to see what I did. So then I shoot this x-ray and we see that he's got a complete S shape going on in his neck, which is causing that spinal cord to get stretched out, which is causing interference from your brain to your body. It's being pulled on, being stretched, so the communication's getting lost. So I explained that to him, talked about how we need to make sure that this top bone is back into its proper position so that everybody else can start falling back into place. So then we take this post x-ray, and this post x-ray was done, I believe, his 18th or 19th visit. And you can see we're starting to get that nice gentle curve back in that neck. We're supposed to have a nice gentle banana-like curve of our cervical spine. So on the post x-ray you can see that curve start to come back, and I actually said, you know, this is fantastic. We're starting to get that curve back, taking pressure off the brainstem and the spinal cord. Have you noticed anything different? He goes, well, it's funny that you should say that. I was going to say this a little bit later, but this seems like a good time. Before he came to see me, had a physical with his doctor. All of his vitals were basically off. Blood pressure's too high, pulse was too high. Everything that could be off was off. He did a re-exam with his doctor about a week before I took those post x-rays. The doctor beforehand joked around with him, you know, if you got to take a test for an insurance company, I might wait a little while because your insurance is going to be pretty high based off of these numbers and what you're spitting out for the vitals here. So he went back in, did a retest, and all of his numbers were right on track. Blood pressure was back, everything was good to go. He told me I didn't change a thing. I probably actually started eating more. I didn't start exercising. The only thing I did was start coming to see you. So that tells us, as I got that top bone unlocked, taking pressure off of that brainstem and spinal cord, reestablished those connections, and the body just got back to work and started fixing those things and making sure they were functioning the way they should.
That's awesome. That's an incredible story. And you know, that's actually not an uncommon tale. We hear a lot of different stories from other upper cervical offices, and we will in the future on this show actually bring in testimonials from different offices across the country, and maybe even Skype some of those doctors in to have them discuss some of those cases from things they've seen in their office. But for now, we're going to go ahead and take another break, and we'll be back. And on our next segment, we're talking about what's in the news. And we're actually going to talk about an article that's related to what we were just discussing with heart disease and brainstem function. So for now, this is Health Beat. Stay tuned.
We own a Habitat home.
I love working on my Habitat home.
Soy dueño de una casa de Habitat.
My neighbor is a Habitat homeowner.
Being a Habitat homeowner has changed our lives.
My mortgage payment for Habitat is less than what I paid for rent.
Habitat for Humanity of Oakland County currently has homes available with mortgage payments lower than most rent payments. If you or someone you know needs decent and affordable housing, call 248-338-1843 or visit our website at habitatoakland.org.
Hello, I'm Mike Bouchard, the Oakland County Sheriff. There's a big problem that faces all the communities in America today, and that's abuse of legitimate prescription drugs. Sometimes they're left in the home when a loved one passes away, or they're in the medicine cabinet for someone else, and a youngster in the home steals it and they abuse it. It's one of the fastest growing drug abuses that we see in our community and across the country. Secondly, we see these drugs oftentimes when they're no longer utilized being flushed down the drain, and we're seeing higher levels of residual pharmaceuticals in our waterways and our streams. So, to solve two problems with one effort, we partnered with Home Instead Senior Care to start a program called Operation Medicine Cabinet to get those drugs out of the homes, out of the hands of youngsters, and out of the waterway, and safely and environmentally destroy them. Learn more about the program at OperationMedicineCabinetMI.com and be part of the solution. Thank you.
Hi, welcome back to Health Beat. I'm Dr. Chris Bennett, and I'm joined by my co-host, Dr. Dustin McIver. This is a segment of the show, a recurring segment called What's in the News, and this is a section that we're going to discuss different scientific journals and articles that have been done on different health topics as they relate to brainstem function and brainstem health. The first one we're going to discuss is an article that was done in the American Journal of Human Hypertension on high blood pressure. And what they found through this study is that they found the upper cervical correction was lowering systolic and diastolic blood pressure by anywhere from 8 to 14 points,
Right.
which they found that was just as effective as taking 2 high blood pressure medications at the same time.
Mm-hmm.
Now this was a pilot study. I know they're going to be doing more studies on this, but it was a groundbreaking study because it was done with upper cervical doctors and medical doctors together.
Yes.
As they went through this. And so, and another one we're going to discuss today is actually one, and this is a big title, that's a lot of big words, so if the audience could bear with me, it's called Decreases in Blood Pressure and sympathetic nerve activity and by microvascular decompression of the rostral ventral lateral medulla and essential hypertension. And that's a mouthful, right?
Yeah. Basically, what does that say? Brainstem.
Brainstem.
Let's just call it brainstem.
It's basically saying we're going to take pressure off the brainstem by surgical means, and we're going to cure hypertension with this. And so what this case was a 47-year-old man that came in, and he had very high blood pressure. It was about 152 over 110, which is really high and definitely outside the normal range.
Yes.
And what they did was they actually did a surgery on that's becoming more and more prevalent in the news. I don't know if you've seen yourself do your own research, but if you basically Google microvascular decompression surgery, you'll see that they're doing this for now a host of different health conditions.
Yeah.
And what they're doing is they're actually going into the brainstem and removing pressure off those vessels of blood vessels and the brainstem that are actually taking nutrients in and out of that area. And they're removing that pressure and allowing the brainstem to communicate properly and function properly. And they're getting amazing results with this. And they're kind of saying, wait a minute, what's going on? So I like to personally thank them for doing our research for us and helping us prove what we do, because it's pretty amazing what they're doing and what they're finding. In this particular case, this gentleman was actually, his hypertension went away after they removed that pressure.
Yeah, the fabulous part about it is they're showing that relieving that pressure off the brainstem is giving us fantastic results. Unfortunately, it's still the medical community. How does the medical community treat things? Through surgery. What we do, there is no surgery involved. We make a simple correction to this top bone, removing that pressure from the brainstem, essentially doing the exact same thing without any operations, without any medication or anything like that. So it's fabulous that there's coming out with this research showing that taking pressure off the brainstem is even more beneficial than taking, like the first journal, 2 medications for high blood pressure. Taking that pressure off the brainstem is better than doing that, but at the same time, they're still doing it through surgery. Whereas we know, we've been talking about the brainstem from the upper cervical world for quite a while now, and we've been saying, hey, you know, we got the answer. We know how to do this. We've been saying it for a while. They're kind of catching up to that now, but they're still, and it's fantastic that they're doing the research, but they're still doing it through means of surgery, unfortunately.
Which really is the tools they have available to them. In the medical community, it's either, medications or surgery. And so a lot of times what I ask my patients is, would you rather me drill a hole into the side of your head or just remove the pressure off the brainstem by moving the atlas back into its proper alignment? And you know what? Believe it or not, most people prefer the by hand, removing the pressure off the atlas.
It's fascinating, really. Yeah.
So so this is, like I said, there's been multiple groundbreaking research articles done on this. Some of them we'll discuss later on in other episodes, discussing with diabetes and a lot of different things. But it's really amazing, the power of the brainstem and what it controls. And when you just remove the pressure and allow it to communicate with the body properly, what the body is actually able to adapt to and heal from. It's absolutely mind-blowing.
Yep, and what is the side effect of upper cervical care?
Health.
That's what we like to joke around, but we joke around about it, but it's true.
Yeah.
Getting like what these articles are saying, having to get surgery. Basically, like you said, it's kind of a joke with your patients, but you are drilling into that top bone to remove the pressure off the brainstem.
Right.
We can get the exact same results. We've proven that we can get the exact same results with no surgery at all, no medication. We're just going in there and making a simple correction on that top bone to remove the brainstem.
Right.
What is the benefit of doing that? You don't have the surgery. You don't have the drugs. One drug usually leads to several other drugs, and then the side effects of those drugs.
And the inherent risk involved with the surgical procedure itself.
Exactly. I don't know about you, but like you said, your patients don't really want a hole drilled into their side of the head. I wouldn't either. I would go to my upper cervical chiropractor before I even thought about doing that. And like we said earlier in the show, the power that made the body can heal the body. Let's give the body the first crack at it. Let's see if your own body, the one that made everything, can heal it. If it can't, then we may have to go down those roads of drugs and surgery. But drugs and surgery should always be the last resort. And for some reason in this country, they tend to be the very, very first thing that we go to. Yeah. Let's let your own body, the one that made it all, let's give him the first crack at it. Let's see if he can fix it first. If not, then we can explore those other avenues.
I agree. So this has been the What's in the News section. And this will be, like we said before, a recurring section on the show where we discuss different topics. And I just want to thank you for joining us today. And
thanks for having me.
And yeah, it was great to sit here and talk with you about these different topics and about heart disease and how it affects the body and how we can, there's other avenues and other options. So I want to thank you for joining us here on Health Beat, and stay tuned for future episodes.